welcome to the Health Chat presented by Oborne Health Supplies. I'm your host, Tonia Maxwell, and today our guest is Katey Weekes. Katey is a highly accomplished clinical naturopath and nutritionist who specialises in hormones, male and female reproductive health, mental health, and pathology. In addition to her clinical work, Katey is the senior clinical consultant and team leader for the Bioconcepts technical support team. She consults nationally and internationally and is passionate about supporting fertility and patients utilising ART, which is assisted reproductive technologies. This coming February, Katey will be a guest speaker at the ATMS Fertility Symposium being held in Sydney. And today she joins us to discuss psychoneuroendocrinology in relation to fertility. Katey, it's a pleasure to have you on the Health Chat, and thank you for joining us.
Thank you so much for having me.
You're very welcome. All right, so psychoneuroendocrinology is a really large and complex word. Can you break it down for us and explain how it relates to fertility?
Sure thing. We could probably even put gynecological psychoneuroendocrinology in front of that, but let's not. But essentially, very, very simply, it's this interplay between the steroid hormones and those fluctuations that happen in the female reproductive cycle particularly, and then that influences our neurotransmitters and their function in the brain. So we think about these steroid hormones, including neurosteroids, as in the driver's seat. So they really drive what's happening for mood and behavior, essentially. And then as far as how it affects fertility, we can use stress as a really simple example here. But, you know, even for the healthy individual, the mere thought of starting a family sometimes is enough to make a regular cycle from your whole life just disappear. You know, all of a sudden it's gone. It was so regular and wonderful, and now all of a sudden I'm planning a family. So where is it gone? Just like the keys or the phone, you know. So it's it has a really profound effect, stress, on just cycles in general from that standpoint. So it could be psychological stress or a physical stress or even a metabolic stress. And therefore it influences things like high circulating cortisol, as you know. So it can, at the crux of it, impair that hypothalamus and interfere with that GnRH secretion. So that's just one example of how stress can affect our hormones, robs our hormones, and just stops us cycling. But then we also see this effect of psychological stress in particular affecting, and high cortisol affecting testosterone in men. So it robs them of their testosterone production, which really affects fertility. And then again, particularly for prolonged periods of exposure to high cortisol, you can see this negative effect on both male and female germ cells, which are what we really need to be in good stead if we want really strong fertility, I guess. And then as far as the headspace goes, stress on its own is enough, but also with stress comes high glutamate levels. So then we start to see influences on things like mood and behavior. So we can get depression and anxiety that's worsening. And for someone who's trying to conceive, or a couple that's trying to conceive, it can be problematic for either of them. So this is just some of the ways that our headspace and our hormones can really affect our fertility and the interplay between them.
That's incredible. I think going through the conception and fertility stage can be really stressful, and it obviously has major impacts on the body. It was interesting that you mentioned neurosteroids, though. Can you explain a little bit about what you mean by that?
Well, I think, you know, when we talk about steroid hormones, we're really talking about predominantly progesterone and estrogen and their influence. They're the ones what we talk about being in the driver's seat. But we're also talking about cortisol as a steroid hormone as well. So yeah, what I mean is, you know, we'll get into this in a little bit too, but essentially in any given normal cycle, we have this big influence of fluctuations of estrogen and progesterone, and then our neurosteroid hormones around that also influence things like dopamine, serotonin, glutamate, and GABA. You know, they're the big kind of main four neurotransmitters that have an influence on our mood and behavior throughout that cycle period. So cortisol is independent of what's happening in our life, you know, but that particularly is going to be driving what's happening for that experience for people. So PMS, I guess, is a really good, simple experience of that. It explains how, you know, as women, we're not linear. We don't have this unique one-line experience through our whole cycles. We have these unique patterns even week to week. So when you even split the cycle into two halves, you've got your follicular phase, which is much higher in things like your estrogens peaking through there in a typical cycle anyway. And then you can have women that are even higher in estrogen or might have estrogen dominance through different parts of their cycle. So they have a higher influence then too. So where that estrogen is higher, in a normal cycle, we see an upregulation of things like glutamate, dopamine and serotonin. So we're relatively in a good mood, we're motivated, we can get things done, we're very that at that point of time in our cycle. And then in the later half of the cycle, the luteal phase of the cycle, if we've ovulated, we're much more dominant in things like progesterone, which is much more calming on the brain and gives us some more relaxation. It's not about doing tasks and motivating, it's about winding down and nesting. But the pathological aspect of that is if someone's super estrogen dominant or super stressed, then we see exacerbations of those presentations. So you start to see worsening of mood in the luteal phase, particularly when you associate it with things like PMS and PMDD. You get these exacerbations to normal mood fluctuations. So there are like normal states of these hormones and how it affects our mood, but then you have these like more pathological or worsening presentations. Does that make sense?
It does. So I guess what you're saying is that if you're traveling through a normal cycle and you're relatively unstressed, if anyone is these days, I guess.
What is that?
It's the sign of the times.
Right.
You'll still have those mood fluctuations, but when you throw stress into the mix, then you're really creating even more havoc.
Yeah, absolutely. Yeah, absolutely. It interrupts, it puts more into the synapse as far as everything to deal with as well. And when you've got more of the stimulatory neurotransmitter function, so when you're talking about things like glutamate, it can be good in a sense, you can use it to drive and function as we've been talking about, but it also disrupts sleep. If you're stimulated, you don't have as quality sleep during sometimes that follicular phase of your cycle, but particularly if you're stressed, much higher levels of glutamate, and we need high quality sleep. Particularly, there's been a lot of research recently about sleep quality and male fertility and how it affects sperm parameters. So we can't underestimate that quality sleep and how the brain functioning at that time affects that sleep. So I think a lot of people struggle with sleep, and we I think overlook it as a simple thing, just get better sleep, but we actually need to work quite hard on having high quality sleep consistently at least. So yeah, that's it's just some of the things that we see affecting fertility.
I'm loving that you're talking about glutamate. I think it's not something that is often spoken about with regards to hormones or with regards to fertility. So, I guess further on we'll go more into that, or I hope that you will anyway.
Absolutely.
So I guess when we're talking about the interaction between the reproductive hormones and our neurotransmitters, what you're really saying is that there's a crossover between the HPA, which is the adrenal axis, and then the HPG, the gonadal axis.
Yeah, absolutely. And then cortisol is that key switch that can switches from one to the other, so we don't want to be shunting hormones down into that flight or fight mode when we really need them to be nourishing and down the pathway of supporting reproduction. Reproductive abilities shut down when we're stressed, that the body's very good at saying now's not a good time, so that particularly chronic influences of high cortisol in the body is going to have a dramatic effect on that capability, even from starting material, so that's very hard to also make changes with in this day and age, because everyone's very go. Everyone's quite motivated and wanting to do and achieve and strive, and those are all really great things, but we can't underestimate how much of an influence that can have and how much we probably could reassess slowing down as part of our preconception care and fertility treatment.
Okay, I really love that. I think that considering the external factors and not just the hormones can have a major impact on someone's journey, not just physically, but also emotionally. I guess if those stress levels are reduced, then they're much more calmer and I guess much more resilient throughout the process of undergoing fertility.
100%. And yeah, exactly. And those that are going through ART absolutely need so much resilience. It's a tough process.
Yeah, pretty nasty. There's the finances involved as well.
So much.
All right. So I guess when we're talking about stress during the preconception period, what sort of nutrient recommendations would you look at?
I have lots of favorites, but I'll kind of narrow it down to some key few ones today because we've only got a short amount of time. So stop me if we need to save some time. But I guess, like in every case, it's absolutely unique and tailored to the individual. But some of the most common nutrients I would pick need to straddle both worlds. They need to straddle the reproductive support, but they also need to straddle supporting mental health in any capacity. Whether someone's going through ART or not, it's really important to nourish that space because we know from what we've just talked about how easily it affects that ability to reproduce. So I guess vitamin B6 is probably the number one thing I give. And I put it typically in combination with zinc and magnesium because this triad or this combination in nutrients, it's required for ovulation, but it also happens to be the rate limiting factors for things like serotonin production, so that pattern or that three nutrient pattern we see quite typically. So I might use doses of around 50 milligrams a day of P5P or a combination of P5P and pyridoxine hydrochloride. As long as we've got a combination, we typically reduce a lot of the risk of things like peripheral neuropathy. But 50 milligrams is really not quite high dose. It's a therapeutic dose, definitely, but people get very funny about giving B6 long term. So I just want to clear that up while we've got the space too. So as long as you're using the activated form, P5P, the risk of peripheral neuropathies are next to nothing. And as long as you're not exceeding even 150 milligrams of B6 total daily, then we're really not in the realm of that kind of presentation. So that's kind of gives practitioners a nice zone to work with, if that helps.
Yeah, I think it's great that you're actually looking at the potential adverse effects of prescribing these nutrients because the fertility journey can go over quite a long period of time. So I really love that.
Yeah, absolutely. We need to consider, and B vitamins are water soluble, so they're low risk in that sense. We can do washouts very quickly with B vitamins, but things like fat soluble vitamins, we need to monitor much more closely because one, they compete with each other. So we can, if we give, say, vitamin A for a long period of time, we can really push our vitamin D levels down, which we know is not good, particularly in this time. But also they have an effect on liver function, because they're stored vitamins, they accumulate. So, depending on how long it takes your patient to conceive, we do need to be really mindful about monitoring how long they're on things. So with zinc, I would probably use 25 to 30 milligrams daily as an average. And then with magnesium, maybe 300 to 400 milligrams a day on average, and then just maybe divide that dose for bowel tolerance. And sometimes I go higher for some people too, depending on, hormone therapy. So things like estrogen therapy, if they've been on the pill, for a long period of time, we can see a lot of deficiencies, nutrient deficiencies, and magnesium is a big one of those. They're the typical doses I use for those nutrients. So they're really helpful for both the mental health space and for reproductive space. So that's why I like to straddle both of those worlds. We want to strengthen ovulation as much as possible, and we want to reduce any depressive or anxiety type symptoms that people are trying to have in this time because we know they have an influence. So that's just one.
I think looking at combining the nutrients as well is really effective in the sense that you're narrowing down not just the amount that someone's consuming for digestive purposes, but again, also financially, it's a very expensive process.
Yeah.
But are there particular forms that you would recommend? So you said P5P or activated B6 for the zinc and magnesium. Do you have a preference when it comes to the forms?
Yeah, I typically use citrate forms of all minerals because we look at the bioavailability and the absorbability of citrate minerals throughout the system being very, very good. So definitely much better than inorganic forms like oxides, as we know. I think people are typically familiar with that. But the other really cool thing about citrate form minerals is that they rely less on adequate hydrochloric acid production in the stomach. We need a lot of good levels of that hydrochloric acid in order to absorb our minerals right at that top level of digestion. And stress, what does that do? It has an awful effect on hydrochloric acid production. So if we can be giving minerals that bypass the need for something else to be given as well, then that's really lovely. But I wouldn't sneeze at using zinc picolinate if someone had that available as well, or magnesium bisglycinates. But honestly, the ratio of magnesium to bisglycinate also throws down the amount of elemental magnesium. So that's typically why I stick to citrate minerals in my practice. But yeah, it's not the only one, that's for sure, but that's what I like to use.
I love that. Thank you.
That's all right.
All right. And so are there more nutrients that you would consider?
Oh, yes, for sure. So talking about synergy of nutrients too, actually, as you just mentioned, inositol happens to be one of the key nutrients that I use, and I'll go through a few reasons why, but that's another one that improves zinc absorption. So, a lot of these that we give together work together. And it's nice to know those things when they do. So, anything like mineral absorption, which can be difficult, anything we can do to enhance it would be better. So inositol, I definitely can't go without. And the situations where we see this increased demand for things like inositol are high blood pressure, which happens during stress, but also metabolic conditions that come through the door. People with PCOS and high BMIs, they can have elevated blood pressure sometimes, high cholesterol, high stress. All these kind of presentations increase that demand, that body demand for inositol. And then, this is a little bit left field, but we're starting to see a bit more of it. But fertility patients with kidney disorders, whether that be only one functional kidney or reduced kidney function, inositol is in higher demand for them metabolically as well. So they're the kind of things that we would typically say, okay, we need inositol definitely for. But then we can see how it functions cellularly. It's Friday.
Another good word.
Okay. So basically, it's really heavily involved in those cellular communications. So it triggers those physiological changes at a cellular level, like proliferation, differentiation, migration, cell survival. So along with things like B vitamin, zinc, vitamin A, you can see how essential that is for healthy conception. We need cells and DNA to be functioning at the best level that it can in order to produce a healthy conception, if that's going to be achieved as well. So it really plays a really strong role there. But it's also a key nutrient in the management of two huge conditions that walk through your door when you're treating fertility. So PCOS and autoimmune thyroiditis. So whether that be Hashey's or Graves', we see a lot of autoimmune thyroid disorders, and it would up there with structural issues be one of the main causes for recurrent miscarriage. And so it's something that we like to check, coming into the preconception period as well. And it actually responds beautifully to a combination of inositol and selenium to reduce things like antibodies. So there's a really large pool of evidence of research for the effect of inositol with comparing it with metformin, actually. So metformin is a common drug used in PCOS women, particularly in ART treatment, and that's to help them manage their insulin dysregulation or insulin resistance. But they've compared the effect of inositol with metformin in these patients, and it's shown to be as effective as metformin, which is super wonderful, without the side effects. So there's a lot of deficiencies, nutritional deficiencies and issues that metformin cause. And we're starting to see, patterns, and I hope to see more research on this, on the effect of women postnatally and babies postnatally. It's long-term studies. So it takes a long time to kind of get that information, but we need to do that for all medications. We need to know what the long-term effect is on everyone who's going to be absorbing this medication. So a typical dose of inositol that I would start with PCOS women would be 2 grams twice a day. It is one that you need to build bowel tolerance with. So if you go any higher than that, which you can, you just need to do it low and slow so that we don't get any runny tummies happening. But that's pretty easy to fix if you just pull back and build very, very slowly again. So think about inositol as our natural metformin, so if someone comes to you with PCOS and they haven't gone into ART treatment yet, we can bring inositol into the mix to try and help their insulin dysregulation as part of our treatment. And so maybe prevent the need for metformin if they do happen to go into ART treatments. So then
Yeah, that's like it's a much more natural alternative, I guess. And years ago, when I was still at college, one of my main thesis assignments was actually on polycystic ovarian syndrome. And so I went quite in depth into the research with regards to inositol.
Yeah.
I think it may be worthwhile talking about the forms here as well. So a lot of the products, 10, 15 years ago were actually based on D-chiroinositol.
Yes, this is a really good point.
Yeah, we're starting to see myo-inositol come through. And it wasn't so much that D-chiro was ineffective, it's more that myo-inositol had a much greater effect.
Yeah, I'm really glad you brought that up. So yes, when I say inositol, I definitely mean myo-inositol. And I think the other thing to check with who you're sourcing it from is because it's, in powdered and sometimes extemporaneous compounding or food grade kind of quality, you need to be checking manufacturing backgrounds. If it goes through food manufacturing processes, it can be contaminated with things like gluten, dairy, you name it, because they don't have to regulate those aspects of food products, and people aren't as aware of that. So that's, something that we look to a lot at Bioconcepts. We don't have a straight inositol currently, but, that's one thing that I'm very careful of when I'm picking amino acids, that I'm looking at the quality of the background and the manufacturing of that product. So form and manufacturing. Yeah.
When we're looking at treating any disorders or giving any sort of support, I think quality is absolutely imperative. And I'm so glad you brought up about the manufacturing, because there has been a lot of grey areas lately with regards to, like you said, compounding supplements. I think that everyone should be asking for a CGMP or a certified GMP qualification, which basically means that the area where it's being manufactured has been certified by the TGA, and it's actually the world highest standard when it comes to manufacturing processes. So
absolutely. Yeah, absolutely. And yeah, just remembering that food grade amino acids and supplements don't have to follow that process. So it's up to the company to select that GMP grade facility and demand that standard. So it's a good question to ask.
Yeah. Awesome.
Yeah.
Okay. Yeah. So we covered B6, or the combination of B6, zinc, and magnesium. Inositol, that's a dark horse. I love that you brought that into it. Is there a third one that you'd like to talk about?
Yeah. Do we have time for me to slot in taurine? I have another amino acid passion.
I really want to talk about taurine. Yes.
Okay, let's do it. Okay, so it's definitely another favorite. First and foremost, it's GABA mimetic. Think about it as our amino, like glycine, glycine's a precursor for GABA, but taurine's directly GABA mimetic. So it really helps that GABA picture. So GABA is our main inhibitory neurotransmitter, our main relaxing one. And not just giving GABA straight away necessarily works for some people. Giving GABA, you can actually go back metabolically and get glutamate, because it can dissociate. So we do get, very rarely, but we do get patient reports of people getting more anxious with giving straight GABA. So that doesn't happen with taurine. So great. So we don't have the risk of making someone more anxious with taurine. So that's a lovely factor about why you would choose an amino acid that acts like GABA over giving GABA itself. So yeah, I have seen that clinically, so I thought it was good to pass on. So it's a really good one to help support sleep. And it also has been correlated, deficiencies have been correlated with things like low motility, low sperm concentration, and low sperm count too. So it's a really great one for men, and it's wonderful for liver support. So when someone's metabolizing hormones in a healthy fashion, they need to be having good liver function. So that's men and women as well. And so even if that's associated with non-alcoholic fatty liver or alcoholic fatty liver, taurine is a good amino acid to have in abundance for those people. So typically we encourage people not to drink around preconception, but that's also very challenging, and it's not always going to be able to happen. So let's just help them be as healthy as far as their detox goes as they possibly can. And then I think I touched on this before, but women in high states of estrogen, so estrogen dominance, which is a bit of a funny term for me, but because we do have estrogen dominance peaks in our cycle where we want to be dominant in estrogen, so our follicular phase, but we don't want to be dominant in estrogen in our luteal phase. So I can understand that reference there. But if you have high estrogen exposure, and that can be from hormone therapy as well, so years on the pill It doesn't associate with obviously menopausal women and replacement therapy there at all, because they're past their fertile stage. But typically it increases the demand for taurine even more. So it pushes, the higher the estrogen level in the body, the lower the taurine. So I think it then, just increases that demand for that. So it's a really cool amino acid. Oh, and there's one other really cool thing I read recently that I have to pass on, but basically it can help increase hemoglobin in people. So we typically see that with iron deficiency or iron anemia, that there can be low hemoglobin. And it's really common in endo patients or patients that bleed a lot. So these people definitely come into fertility clinics. But basically, it's antioxidant taurine, which is wonderful, obviously, for sperm and all those kind of cells that we want for reproduction. But it also works on increasing that half-life or the survival rate of red blood cells. So that's how it increases hemoglobin in the body. So it's really good as part of anemia treatment if you're treating, because you want to treat anemia before someone falls pregnant. So in this preconception period, we're really focused on making sure everything's at its peak, because we have to chase our tails otherwise through the pregnancy, and that's really, really hard to do. So a typical dose I would start with is a minimum of about 3 grams a day with taurine.
It's quite common for iron to become deficient in the first trimester of pregnancy as well. So taurine, I think, is another gold star for being a bit, looking outside the box, because I think traditionally we're encouraged to think about taurine when it comes to reproductive processes in regards to males, like you said, the sperm motility, the actual sperm quantity as well, and not so much the fact that women are probably a bit more likely to be insufficient in taurine because of that estrogen drive 100%, on the liver.
And it just chills everyone out. It is very relaxing, and it definitely works well for improving sleep quality too. So it's doing all those metabolic things, but it also, like, one of the main reasons I use it is because it just relaxes people.
Instant chill pill.
Yeah.
Right. Okay, so if we look, I guess, more on the couples that are undergoing ART processes or having struggles with fertility, are there nutritional considerations that you would look at sort of separate to the ones that you've mentioned?
I don't think there's too much change. It would typically be how they respond. So I still look at all those key nutrients when I'm treating ART patients. But I guess the first thing that we need to remember about the differences here is that more often than not, they're not using their natural cycles. So it might be a single woman, it might be a couple, but they're typically having artificial cycles or cycles that are controlled medically. So the hormones and hormone levels are not the same fluctuations that we see through a typical cycle. They're more exaggerated by that process. And so we don't see those same natural beneficial aspects on the neurotransmitter patterns. So it's very typical to have your ART patients saying they feel crazy or they feel not themselves at all through this process. And they're also at the whim of that medication. So we don't want to be counteracting what the medications are doing. We definitely want to work synergistically with ART. The combination is beautiful, by the way. If fertility specialists and naturopaths work together constantly, I swear we'd see a massive difference in live birth outcomes. So tell me when someone's ready to fund that research, because I'm sure there's a few of us that will be on board with that. Because, the combination is just really, really beautiful. So like progesterone, I guess, is a good example of this. If someone achieves a chemical pregnancy, and so they have a positive, pregnancy test after one of their cycles, typically you see them put on progestin or synthetic progesterone to help sustain that pregnancy. But we know our own normal progesterone is beautiful and relaxing on GABA. Progestin doesn't have that same effect, so we can't rely on those hormonal medications that they're receiving to have the same effect on our neurotransmitters. So we have a look, I guess, more strongly over the headspace of people going through ART. So 1 in 8 couples in general have complications achieving pregnancy. And then when you talk about how many of those experience depression and anxiety, significant depression is seen in about 60 to 75% of ART patients. Anxiety is seen in about 60 to 75% of those patients, and 30 to 55% of those couples also experience significant depression. That's a really big number, right? And what if you're single during that process? What if you're dealing with it on your own? You know?
It is. That's really powerful. It's supposed to be, you know, like trying to conceive and create a baby is supposed to be, you know, such a happy kind of time. And those statistics are really quite frightening.
Yeah. And I think, people have these preconceived notions of what it's all going to be too. And if you only have to go through it once, you know, people have to do cycle after cycle sometimes. That's not uncommon at all. And then the extended effect that then proliferates on depression and anxiety is quite marked. So we see things like antidepressant and anxiolytic prescriptions that are really common in ART patients, and that's sometimes essential and life-saving, because people, the more cycles they do, they typically withdraw more and more from their support systems. So they might tell people when they're going through their first cycle, but they may not tell the second or the third or the fourth cycle. Yeah. So this social isolation too only builds depression and anxiety. We've seen what social isolation has done over the last 2 years. So this is, you know, imagine this last 2 years plus ART treatment. It's very intense on their mind. And I think it's very important to refer, obviously, to psychological support as well. They typically have, IVF facilities will have genetic counsellors on board, but they don't necessarily typically give psychological counselling unless it's something that's come up about the process, you know. So making sure they're in that kind of support network too. If they don't want to talk to family, it's okay to not want to talk to family and friends during this time. It's so personal, you know. So I don't see a problem with people just saying, I don't want to talk to anyone else about it. Give me someone independent that I can, you know, leave the office afterwards and not worry about it, you know? Yeah. So I think that referral is really important. But say someone is on these prescriptions, something like magnesium is profoundly important because it is how SSRIs work, you know? So giving magnesium actually augments those medications and makes them work better. That might mean that they can then pull back on dose gradually and maybe even come off things eventually. So that's really helpful for them. So the SSRIs exert their effect by raising brain magnesium levels and inhibiting that NMDA receptor complex. So they really, really rely on sufficient magnesium pools, but they also rely on a sufficient pool of serotonin. It's not just enough to expose that synapse to more serotonin for longer. We need enough serotonin to put into that pool for that process. So adequate amounts of amino acids, you know, so protein, these are really important here in order to support a medication working well. That's why we see so much variance in how SSRIs affect people. You know, if they work well in some people and they stop working over time, is magnesium getting deficient for those people? Or they don't work in others at all because they don't have serotonin or magnesium at a sufficient level. So there's some of the nutrients that I would probably look into extra mile when it comes around prescriptions with ART patients and making sure they have a very strong headspace and making sure their depression and anxiety are much more manageable and as manageable as possible.
So important. So very important. And I think a key thing that you said was about, it's not just about having the serotonin or looking at the SSRIs reuptake inhibitors. It's about how much serotonin is actually available to do its job. And that's often not thought of at all.
Not at all. Not at all.
Protein, macronutrients. So as naturopaths, obviously we'd really love everyone to have a very healthy core foundational diet. When we're talking about fertility and mental health, are there key things that, I guess protein would definitely be one of them. Are there key things that you would look at when it comes to dietary choices or dietary recommendations?
Definitely. I think we look to be as nourishing as possible, as you said, during this time, and reducing toxic load is obviously very important. So we talk about the importance of organic produce wherever possible, how to mitigate those effects in some things by choosing, low tox choices and washing our vegetables properly and those kind of things, and supporting our detoxification systems through that process. But I guess more than anything, it's diet movements that I see, certainly hypercaloric diets are a problem. High BMI is a problem in fertility at the moment, and they impact conditions like PCOS as well. So And also that obesity factor, or even just being a little bit overweight or even unhappy with your weight psychologically, really affects your mental health. So there's a lot of people that need to lose weight as part of their process. Sometimes they're turned away from ART treatment and said, lose 10 kilos, here's metformin. Mm-hmm. Here's metformin, lose 10 kilos, and then come and talk to me. So a lot of the coaching that happens is around trying to make dietary changes and lifestyle changes, and that is a very hard thing to do. Mm-hmm. People often look at it as a short-term diet. So we're trying to make more shifts, small shifts in changing their habits so that they hold on to those habits. But the other movements that we see a lot more of now are plant-based diets, so a lot of vegetarian and vegan diets in particular. I'm a massive advocate, let me say that first and foremost, of plant-based food choices, and I definitely feel like they should dominate everyone's diet. Because they're alkalizing, they reduce oxidative stress in the body, they provide all this beautiful essential fiber for all our all-important bacteria, and we know that affects our mental health. We know our microbiome affects our mental health greatly, and we know from beautiful work that Leah Heckman's doing how much it's affecting our reproductive microbiome. But I rarely see a well-executed vegan diet walking through my door, and that really concerns me. It's always dominant in carbohydrate, meat replacements, soy, and insufficient protein. There's just not enough protein intake. And it doesn't mean you can't conceive if you're vegan, but it definitely limits that dietary aspects, like macronutrients can be limited as well as micronutrients. And they need to be accounted for early, like we were talking about, because it's too challenging to catch up in pregnancy, and the baby will just take what the baby needs. So we need to make sure that those levels are at sufficient levels. And so we start to see quite a lot of mental health disruption in those patients that have poorly managed protein and micronutrient and macronutrient intake in that preconception period. They don't love their pregnancy as much as they want to sometimes. And postnatally, when they're trying to breastfeed and all the nutrients are coming out of you as a mother, so we're looking at a long-term issue. You're not just looking at the ability to conceive. We're looking at how that experience through pregnancy and postnatal period is going to be, even if everyone's health is fine, so even if baby's outcome is completely fine. So the obvious ones that people do remember to supplement, because they do a lot of reading if they're vegan, they're typically very well educated, is B12 and vitamin D. So they're usually already supplementing that when they come through my door. But we need that protein to provide the amino acids required for that neurotransmitter synthesis and production. That's what neurotransmitters are made from, protein. So without that protein or those building blocks, we don't have the ability to make sufficient amounts of neurotransmitters sometimes, so that's a problem for someone with depression and anxiety. And there's all we can do with supplements in the world, throw at it. But if someone hasn't got the baseline material, then those things aren't going to be effective. We have to be really honest about that. So I do a lot of education around cleaning up the vegan diet, which sounds hilarious when I say that out loud.
Cleaning it up. Yep.
Yeah, exactly. So taurine's a really good example here too. So an omnivore diet, so someone who has meat and plants, that diet provides only about 400 milligrams daily of taurine. So we've talked about how much we need it. And that 400 milligrams is below our daily requirement of what our body needs to utilize metabolically. So you can see how something like, if you remember, estrogen affecting taurine as well. So if someone's vegan, they've been on the pill for a long period of time, you can see how they can very easily be deficient in something like taurine, and that can have a massive impact for their mental health space. If it doesn't affect their fertility, it has a big impact on their headspace. So yeah, I don't want to be attacked or have tomatoes thrown at me by vegans. I love plant-based foods, don't get me wrong, but I think it's actually quite hard to be a good vegan. And I think most people would agree with that.
Yeah, look, I definitely agree as well. I think that to get all the nutrients that you require from a vegan diet, there's a lot of effort that needs to be put into it. There's a lot of thought with regards to the actual ingredients and combinations and so on. From a naturopathic perspective, I guess we think that we can be all over that. But from your average consumer or your patient who's looking to conceive, that's a whole different ballgame. So often their understanding of veganism is not even close to what we understand to be from a nutritional perspective.
100%. Yeah.
Impacts on mental health. I'm really glad that you brought that up as well, because the first thing that came into mind was when you mentioned before about the glutamate and the switch between glutamate and GABA, and those nutrients are just so important for keeping that flowing in the direction that the body actually needs it to go.
100%. Yeah, absolutely.
Yeah. All right. Oh, that's really good. So we've covered diet. We've looked at the hormones. We've looked at the neurotransmitters. We've looked at the interaction. Understanding, I guess, now that stress really does impact both the reproductive system and the brain, but it's really cyclical in nature, isn't it? So the brain's going to affect the hormones. Hormones are going to affect the brain. Stress will affect either of them, and both of them can create stress. So I guess interchangeable between them all.
Yeah.
All right. So I think then, do you have any other nutritional or any other guidelines, I guess, that you would like to bring up when we're looking from a patient's perspective in a holistic manner?
Yeah. I think we've covered a great deal, but I guess one thing I'd like to pass on is the importance of training yourself around the language within the fertility space and nurturing the patients coming through. So we can have all these fancy, well thought out prescriptions that are super targeted. They're going to be amazing. But if we use the wrong language, or we don't nurture that patient enough through that process and give them exactly what they need, listening space, it can mean nothing. Like, I think that's one thing that's said to me by fertility patients all the time from lots of different, practitioners, whether it be medical world or otherwise, is that, everything's fast paced. They're on to the next patient. So you're just, a cow in line for the next treatment. So they can feel, sorry,
go ahead. It's so sad that they feel like they're being treated like herded cattle.
Yeah, absolutely. And I think, bedside manner after a while starts to slip occasionally if someone's having a bad day. We're all human. So I think one of the strongest factors that I try to bring consciousness to in my clinic is the way that I deliver information and make sure I hold a very nurturing space for those individuals. So, like even the language that's used in the fertility space, like failed cycle, like when they're going through IVF, there's all this like negative, like the way things are just termed medically, and that weighs on people, So even simple things like plucking this beautiful positive aspect out of their case, whatever it might be. So you've got a woman who's got recurrent miscarriage, so she might be 4 or 5 miscarriages deep, and be able to kind of say, well, you've got the conception part down pat. Like, that's really hard. Some people can't even conceive. So having some positive reflection on some of your language can be absolutely key and can make or break someone's ability to then even take on another cycle of IVF. They might be on the brink of giving up, so you can really nurture that space when other people don't have the time. This is where naturopaths are the best, because we don't always have a ton of time in clinic as, either, but we are geared more to nurturing that space for people. So I really want people to realize that they can deliver their hard-hitting scientific high-tech prescriptions and be amazing fertility naturopaths. But that's the magic, that's the glitter, that's the dust on top that just makes you stand out from the crowd in that fertility space. Being as nurturing as possible, because you don't just have couples coming through, you've got single people coming through, you've got people that are getting whether it be egg donations from other people, sperm donations from other people, some people dealing with surrogacy. There's a million different ways that people go through this ART process, or even people that aren't in the ART process. It might take them more, not a month to conceive. They're like, oh, I thought I'd be able to do it right away. And that weighs on them too, and just saying, oh, it's very normal for it to take a year. Just that simple line is like, oh, I'm normal, So there's just such simple things that we can start to weave into our language. And if we prepare for that, knowing that we're going to hear a lot of things like recurrent miscarriage, failed cycle, if we prepare how we would authentically respond in that situation, it comes out very naturally. And I can tell you the patients then feels comfortable. They're like, oh, she's got me. It's good.
That's great. So it's really about putting some conscious thought into what message we as practitioners are giving to the patients. Consciousness.
Absolutely. If you give that awesome prescription in a gruff, here it is, you'll be fine way, it's not as effective. That placebo effect is super strong. Don't underestimate it, you know. It can really make your prescription stronger.
Oh, that's beautiful. I love that you've ended up or ended this on that type of topic. Mental health and supporting our patients is ultimately the goal that we want to achieve.
Absolutely.
On their journey. Yeah. Katey, thank you so much. You've given us some really comprehensive information, definitely some out-of-the-box considerations. I guess we're going beyond what we traditionally think about when it comes to supporting our patients and their reproductive or their fertility journey. I really hope I have the opportunity to hear you speak more at the upcoming ATMS Sydney, which is which is being held in Sydney in February next year. Thank you so much for your time.
Absolutely, my pleasure. Thank you so much for having me.